Gynecological cancers. Think A to G. B. Bleeding.
90% of women with endometrial cancer will have some form of abnormal uterine bleeding. The vast majority will be postmenopausal women. So in the postmenopausal woman with postmenopausal bleeding, I would recommend you refer them all on the 2-week wait pathway. I wouldn't particularly delay for a GP speculum, an assessment if you've got prompt access to a one-stop postmenopausal clinic. NICE does recommend GPs assesses and considers a speculum before referring on. But if these women are going to be seen within a week or so, they'll have all of those tests done all at one stop by a specialist. And I think that's the most time efficient way to do that. Any abnormal bleeding at whatever age, we need to be concerned, is there a cervical cancer? So this group requires assessment by the GP and a pelvic examination so that we can get them down the right referral pathway. If we think it's a postmenopausal bleed and the cervix is normal, they need to go to a one-stop PMB clinic. If the cervix is suspicious, they need to go to a general gynae clinic where we can biopsy the cervix at that same visit. With the younger women, what we find is there's a higher incidence of infection with postcoital bleeding, so that should be screened out in primary care.
GatewayC Live, Greater Manchester. Fast facts, supporting earlier and faster cancer diagnosis.